Hi, I'm Sandy Hudnall, and I'm here to present the Eye and Ear Systems for Medical Office Terminology 2, Miss Kim McKenzie's class. Let us begin. Light enters the eye through the cornea. Then the light waves pass through the aqueous humor, then into an opening in the iris called the pupil. The light waves enter through the refracting structure called the lens. Waves of light then pass through the vitreous humor and travels through the retina. The rods and the cones are then activated. Finally, the optic nerve sends signals to the brain, and visual interpretation is the outcome. The eye, sclera, cornea, choroid, ciliary body, pupil, iris, lens, retina, cones and rods, the optic disc, the fovea, the macula, and the optic nerve are all responsible for sight. The lacrimal glands are located on the upper outer corner of the internal eye. They are almond-shaped structures and they produce tears. Lacrimal ducts are excretory ducts of the lacrimal gland, which are the tear ducts. The limbus forms the border between the cornea and the sclera. It contains pathways for aqueous humor outflow. The lacrimal sac collects tears, and these tears empty into the nasolacrimal duct. The caruncle is located in the inner corner of the eye. The nasolacrimal duct is responsible for the flow of tears to enter the nose from the eye. Here are a few diseases of the eye. Blepharitis. Some of the symptoms are inflamed or infected eyelids paired with crusty eyelashes and irritated eyes. Some treatments would be topical antibiotics or corticosteroid ointment. Hyperopia is causing farsightedness, not being able to see things up close clearly. Wearing glasses or contacts to correct the problem or having surgery to correct the eye would be a treatment for hyperopia. Corneal abrasion is irritation or damage to the cornea. The chronic damage could cause an ulcer. Corticosteroid or antibiotic drugs or surgery could be a treatment. Conjunctivitis, which we all know as pink eye, is very contagious conditions due to allergies, pollens, bacteria, or viral infections. Steroid eye drops, topical or oral antibiotics could treat the problem. Glaucoma is increased intraocular pressure and can progress to blindness. Drugs to lower pressure of the eye or surgery could be a treatment. Cataracts are murky, cloudy, fading area of the lens of the eye. Cataract surgery could be helpful for cataracts. We also have diabetic retinopathy and macular degeneration, wet or dry. In diabetic retinopathy, blood vessels constrict due to high blood sugars. Treatment would be controlling diabetes and or surgery. Macular degeneration is progressive loss of vision of the macula. Therapy and drugs could treat the wet, and there's no cure for the dry. Papilledema is inflamed edema of the optic disc, and you could correct the underlying cause. Retinoblastoma is a cancerous tumor of the retina in children. Drugs, chemotherapy, radiation therapy, or surgical removal of the tumor could help with the retinoblastoma. Here are a few procedures. Gonioscopy is a procedure to check for chronic angle closure glaucoma. It's a painless procedure that checks for blockage within the eye between the cornea and the iris. Cataract extraction is a surgical procedure that removes the cloudy lens of the eye and replaces it with an artificial lens. Enucleation is a surgical procedure that removes the eye, and the surgeon may replace the damaged eye with an implant. Blepharoplasty is a surgical procedure to remove saggy, excessive skin, muscle, and fat from the eyelids. Tonometry is a procedure to test for increased pressure of the eye in glaucoma. Here's a few fun facts about the eye. The eyes begin to develop after 2 weeks of conception. All of the memories we obtain, 80% come from our sight. Most people have brown eyes. Actually, 70-90% of the people in the world have brown eyes. Green eyes are rare, and only around 2% of the world's population have green eyes. I do have green eyes. A few home remedies of the eye. You could use aromatherapy for inflammation of the eye. To remove an object from the eye, you put a flax seed in the affected eye, and the dust, etc., will disappear, and the flax seed will remove itself. For a sty or infected eye, you put a wooden spoon of boiling water until the spoon is hot. Wrap the spoon in a cloth and hold it onto the infected eye. Repeat this several times a day until the infection or sty is gone. Now to the ear. Sound waves enter the ear through the ear canal, then to the eardrum. The sound waves send vibrating messages to the ossicles, which are 3 tiny bones in the middle ear. The tiny bones are the malleus, incus, and stapes. The vibrations are then sent to the cochlea. The cochlea contains fluid in the inner ear, and the vibrations bounce off the fluid of the cochlea and causes motion of tiny hair structures in the cochlea to create electrical signals. At last, the auditory nerve sends these signals to the brain, allowing noises to be heard. The external ear is termed the auricle or the pinna. The external ear is made up of the helix, the outer folded part of the outer ear, the external auditory meatus, which is the opening of the external auditory canal, and this canal is the passageway that leads to the eardrum from the outside of the ear. The tragus is a triangular prominence of the inner side of the external ear, and the earlobe is the fatty, fleshy part of the lower external ear. And here are a few diseases of our ear. Cholesteatoma, earaches, dizziness, headache, a benign tumor of the inner ear. Surgical removal could be a treatment. Meniere's disease is a disease of the inner ear affecting the cochlea, causing tinnitus, vertigo, hearing loss, and nystagmus. Correcting the underlying cause could be a treatment for the disease. Otis externa, which is swimmer's ear, is a bacterial infection of the external auditory canal. Throbbing pain due to foreign object or water in the ear. You could use topical or oral antibiotics. Hematympanum is bleeding in the middle ear behind the tympanic membrane caused by trauma or severe infections. Antibiotics for infections would be a treatment. Labyrinthitis, bacterial viral infection of the semicircular canals causing extreme vertigo. Antibiotics for bacterial infections could treat it. Acoustic neuroma is a benign tumor of the vestibular nerve that can cause pain, dizziness, and hearing loss. Removal of the tumor could be a treatment. Cerumen impaction, simply earwax, causes blockage of the ear canal and could cause pain and discomfort. Eardrops or removal of the earwax would be a treatment. This also could cause hearing loss. Otitis media is a bacterial infection of the middle ear. Also, there could be a buildup of fluid in the middle ear. Inflammation of within the tympanic membrane, infection may cause a feeling of pressure. Antibiotics and surgery could be an option. You have conductive hearing loss and sensorineural hearing loss. Progressive hearing loss, a foreign object lodged in the ear canal, fluid buildup, etc., feelings of discomfort, pain, etc., losing the ability to hear. Treatment for the conductive is correcting the underlying causes, hearing aids or cochlear implants. Diseases of the cochlea, damage to the ear during loud music or aging, etc., loss of hearing, discomfort, pain, and problems with balance. Correcting the underlying causes of hearing aids or cochlear implants may be needed. Here are a few procedures of the ear. Audiometry, a test that's given to measure a patient's hearing by listening to different tones and pitches. Brainstem auditory evoked response is a test given to see how the brain responds to auditory information, while an EEG is given at the same time as the brainstem auditory evoked response test is given. Auditory brainstem respond. This test is given to check for lesions or tumors on the auditory cortex, brain, or on the vestibular nerve. If there is a lesion or tumor, an abnormal EEG result is found. Tympanometry is a test to check for movement of the tympanic membrane and the bones of the middle ear. making certain there is no damage to either the tympanic membrane or the ossicles. Here's just some fun facts and just for fun. The ears continue to hear sounds even while sleeping. Fish have internal ears. They can hear or sense movement by their scaly bodies. A couple of little jokes I just threw in for a little bit of humor. How much does it cost a pirate to pierce his ears? $1 an ear. And what do you call a bear without an ear? Simply be. A few home remedies of the ear. To relieve itchy ears, try mixing 1 tablespoon vinegar with 3 tablespoons water. Dip a cotton swab in the solution to clean your ears. It works very well, according to Sammy Miller. For ear infections, wrap some onion slices in foil and put them on a broiler until juicy. Put the juice from the onions into the ear. To remove earwax, use a dropper to insert olive oil or baby oil and place a cotton ball over the ear canal overnight. By morning, the excess earwax will have softened and will be easily removed. This concludes the PowerPoint presentation of the eye and ear systems. Thank you.